Back here with PhysioU Sports Health. I'm Dr. Hartman. I'm going to walk you through the starting position for a deadlift, as that's going to be one of the most important things that you're going to focus on for the actual deadlift itself. So we're going to have your patient or your client bend down and grab the bar. Good. And then you're going to want the hips slightly higher than the shoulders. Now what you're going to want to see is that in this position they can actually retract their shoulders a bit at this height. Not everybody's going to have the hamstring length, the lumbar mobility, or the hip mobility to start at this height, so you may have to start them higher by bringing the bar up to them, as there's no option to bring them lower toward the bar, because you want to start with straight arms. So you're going to want to look at chin angle here. You're going to want it between 60 and 90 degrees, exactly how she is. And then what you're going to want to see, like I said before, is a little bit of tension and tone into the mid and low back here with a flat or neutral low back. When she starts this drive, she's going to lift up. The first thing she's going to do is sit back a bit and pull the bar towards her shins, and that's going to start the drive. Then she's going to lift up and pull. And as she's pulling up, you're noticing that she's pulling her hips towards the bar. The bar isn't getting pulled towards her. That's a very important part. You want your hips to drive towards the bar, not the bar to be pulled toward you. So the bar will always be the same distance from your body, because the best way to do this lift is to have a straight and perpendicular bar path to the actual ground. And as Jess comes back down, the same thing, a straight bar path with her chin tucked, and she ends in a flat back position, and everything else looks symmetrical. So after reading my article, you should know how to start and perform the deadlift correctly. What I'm going to show you now is how to perform the deadlift incorrectly, or common faults seen with the deadlift. So Jess is going to grab the bar, and one thing that you wouldn't want to see when you start is feet too close together. So if she were to start with her feet together, or bring your feet apart, the correct form would be hip distance apart, seeing the knees come inwards, or starting with a rounded low back here, meaning that the bar should probably be brought higher because she's getting a posterior pelvic tilt and isn't able to reach the bar at this distance from her body. Not everybody should start the deadlift with the bar on the ground. That's a common misconception. You should bring the bar up to them. Another thing that you could possibly see is a chin angle like this as she drives up, or even in the start. So if she were to lift from this position, you're putting the low back at risk. You're going to put the cervical spine, thoracic spine at risk. And you're also, if her knees dive in or forwards, you're going to be putting the medial compartment or lateral compartment of the knee at risk for injury as well.